Welcome, friends. Today we have one of our very dear callers who has reached out to us with a question. Welcome, Harry.
Hi, Dr. Majeed. How's it going?
All right. Thank you.
Sure.
So, what is your question?
I wanted to call in today because I've long had a problem with extreme sensitivity.
Mm-hmm. So, extreme sensitivity to what?
Just like other people, and just kind of like in general, like just like sensitivity to criticism,
Mm-hmm.
sensitivity to like if people like just say something that was meant to be neutral to me and I take it personally.
Got it. So, sensitivity in the context of people, interpersonal sensitivity, or rejection sensitivity.
Yeah.
Okay. And how is it impacting you?
So basically, one of the biggest ways it just holds me back from like relationships in general. Like it makes it hard for me to maintain a relationship with somebody because it feels like I get I just get hurt so easily and I feel things so deeply.
Hmm. Got
Like if
it.
they say something like somebody could say something really neutral like, oh, your ears are big and like I would just take it so personally.
Got it. So you said it affects your relationships, like friendships.
Friendships, possibility of entering into romantic relationships. Yeah, just in general.
Got it. And when did it start?
It was around since as young as I can remember, like probably like 4 years old, 6 years old.
Wow. So that is common.
Yeah.
So there are few factors that play a role in that. One is with the nature, which is our genetic makeup.
Mm.
And there are certain kids from infancy, they are more sensitive. So, temperamental sensitivity and temperament, mostly a big part of it, we are born with. So, that is one. And the nurture part, usually it happens with more invalidating experiences from a young age where our feelings are not considered valid. How was your environment growing up as far as you remember?
Um, what was my upbringing like, you mean?
Mm-hmm.
My upbringing was, yeah, I mean, my family said mean things to me, and I was, abused. Um,
Sorry about that.
yeah, it's okay. So yeah, and, it wasn't always easy.
Any bullying?
Yeah, I experienced a fair amount of bullying. Yeah,
Got it.
high school, middle school.
So, unfortunately, those early experiences do create that sensitivity. How does it impact you on new places? Let's say shopping mall or people who you don't know
Um,
or who are not kind of, you're not communicating with them necessarily.
um, with a shopping mall and just in public places, it kind of just, I'm trying to think, like it just kind of makes me like hyper aware
Mm-hmm.
of people in general. Like if if they look at me what I think is a mean way, or they just, you know, like I'm
Mm-hmm.
passing right by them and Like they don't move out of the way. I assume that they're so rude and I get really hurt by it.
Mm-hmm.
And my mind just kind of sticky. It just sticks to it and I can't get rid of those feelings.
Got it. And do you work, or does it come in any way, this sensitivity comes in any way of your career choices?
The sensitivity does get in the way of career choices because, you know, like with any job, you have to have socializing. And especially in the jobs that I've done so far, like retail, um, people don't always treat you the best. So that
Mm-hmm.
can be really quite difficult for me to do.
Mm-hmm. Got it. So, um, so that's where you're caring. So from a young age, you have developed, and you might or might not have that temperamental sensitivity to begin with. And then your environment taught you that your emotions are not valid. And with those traumatic or bullying experiences, in a way, you have started giving meaning to other people's intentions, that what they want or what they're thinking of you is not nice, or their intentions towards you are hostile. Do you relate with that?
Yeah, definitely. Absolutely.
Okay. So there are external events that take place, and there is our perception of them. And our perception is mediated by our previous experiences or our lenses through which we are viewing those events. So two people might experience the same thing but interpret it differently.
Yeah.
As you are facing more and more world, I think your goal would be to go more with um, your intentions, and instead of preconceived notion that others would be hostile at you, I think you will have to one challenge that. And um, hold on one second. So instead of that preconceived notion from previous experiences, we want to challenge that and go and practice more neutral dialogue, which is not automatic dialogue happening for you, but because it is from that place of judgment. So in a way, you're projecting what others are thinking of you, and from previous experiences seem like that projection of internal experiences is negative, so it feels others would be hostile towards you to begin with.
In other words, you're saying like I'm really taking the bad that I experienced in earlier experiences and um, projecting them onto the current ones.
Yes. And there is another selective attention bias where we start to look at, we pay selective attention to the negative. So if you have 10 experiences, 9 positive, 1 negative, so with selective attention bias, your brain is likely to remember that one negative far more strongly.
Wow, I never knew that.
Let's start paying attention to the positive experiences as well. And our goal would be to not let the past control us. And also designing some ways, and mindfulness is or meditation is very effective for that. But if you pick or identify early that you're experiencing that, then using the soothing skills, the 5 sensory skills to bring yourself back in the moment, because your brain is in a way going back to far younger age when you'd experienced other negative events as well. So you
Yeah.
want to bring yourself in the present moment, and your goal is to not um, react to situation, and maybe if there is a negative event, you still want to check with somebody else if they would also find that to be as hostile as it had felt towards you.
So get other people to like what their opinion is.
Particularly those who you trust, or whose opinions you feel like they could give you a balanced view.
Gotcha. Gotcha.
And these five sensory skills, basically distress tolerance, so that deep with the deep breathing and using five senses, so touch, smell, seeing what, so intentionally, and then describing it, that could bring you back in the moment. So shifting the perspective, bringing yourself in the moment. And third, um, also building more positive experiences, and kind of making a note of that. Some people make a gratitude list or thank you list, where you're actively tracking the positive experiences to counter the negative selective attention bias.
So just pretty much just focus on seeing the positive. Like my mom always used to say, um, try to see the world like with rose-colored glasses instead of gray ones.
Optimism does play a big role. Optimism definitely helps. And I think the other thing is that you want to focus on your intentions. So if you, Harry, your intention is to get something accomplished, let's say for shopping mall or for your career options or family interaction. So if you have certain intentions, so rather than focusing on other person's intention, stay focused on what you wish to achieve, and that would keep you in a way more goal focused, um, rather than over time stopping you from pursuing what you are going to do.
Gotcha. So keep focused on goals.
And other people also, remember, other people are also thinking what you are thinking of them. So this mainly, if we focus more our energy on what we need to do, then more goal focused, and other people's negative interactions, also you want to put that back onto them, that if somebody is behaving negatively, it's not because of you, it's because of them.
Gotcha. Gotcha. Well, that really helps a lot, doctor. I really appreciate that.
Thank you so much, Harry. It was pleasure talking to you, and we'll look forward to hearing how you trying these few tips works for you. And remember, I would also highly encourage you to seek help from your local mental health care provider as well on a regular basis.
Well, thank you so much, and absolutely same to you.
Thank you. Take
Bye.
care.